What if I told you that one of the most commonly prescribed blood pressure medications in the world affects nearly 1 in 4 people in ways they never expected? Amlodipine, taken by over 50 million Americans, is a cornerstone treatment for high blood pressure and chest pain. But its side effects, some subtle, some serious, aren't always fully discussed during those quick doctor visits. Today, we're diving into the complete landscape of amlodipine's side effects, backed by clinical data and research, so you can make informed decisions about your health. Please note, this video is for informational purposes only and not a substitute for medical advice. All information has been carefully verified, with source links in the description. Side effect 1. Dizziness. One common experience with amlodipine is dizziness, a sensation of lightheadedness or unsteadiness. This is more noticeable at higher doses or when you first start taking the medication, as your body adjusts to changes in blood pressure. You might feel dizzy when standing up from sitting or lying down, a condition called orthostatic hypotension. To manage this, move slowly when changing positions, sit or lie down if dizziness hits, and stay hydrated, as dehydration can worsen it. Persistent dizziness may mean your dose is too high or other medications need adjusting. Talk to your doctor if it continues. Side effect 2. Edema. Swelling, particularly in the legs or ankles, is called edema and is one of amlodipine's most common side effects. It happens because amlodipine widens blood vessels, increasing pressure in capillaries, which can leak fluid into surrounding tissues, causing swelling. This is more likely at higher doses, like 10 mg daily. Interestingly, clinical trials show women are 2 to 3 times more likely to report edema than men. Monitor swelling and report it to your doctor, especially if it's severe or sudden, as it could indicate other issues. Side effect 3. Weight gain. Amlodipine doesn't typically cause weight gain from fat or muscle, but fluid retention, like we discussed with edema, can increase your weight. This is especially concerning for heart failure patients, where rapid weight gain could signal fluid overload or worsening heart function. If you notice sudden weight changes, report them to your healthcare team immediately. They'll assess whether it's benign edema or a more serious issue requiring intervention. Side effect 4. Angioedema. Angioedema is a rare but serious swelling that can affect the face, lips, tongue, or throat. As a calcium channel blocker, amlodipine can, in rare cases, trigger this fluid buildup in deeper skin layers, potentially obstructing airways and becoming life-threatening. If you experience sudden swelling or difficulty breathing or swallowing, seek emergency medical attention immediately. This is not common, but it's critical to act fast if it occurs. Side effect 5. Fatigue. Feeling unusually tired or fatigued is another side effect some experience with amlodipine. This lethargy can affect daily activities and isn't necessarily dose-dependent. Many blood pressure medications cause tiredness, especially when you start or adjust doses. The good news? Fatigue often improves as your body adapts to amlodipine. If it persists, discuss it with your doctor to explore potential causes or adjustments. Side effect 6. Flushing. Flushing, where your skin, often on the face, neck, or chest, feels warm or looks red, can occur with amlodipine due to its blood vessel widening effects. This is more common at higher doses, and clinical trials show women are 3 times more likely to report it than men. Flushing is usually harmless but can be uncomfortable. If it's bothersome, discuss it with your doctor. Side effect 7. Palpitations. Palpitations, a sensation of a fast or irregular heartbeat, can feel like your heart is pounding or skipping beats. This can be unsettling and is more likely at higher amlodipine doses. Clinical trials found women are over twice as likely to report palpitations than men. While often benign, palpitations can sometimes signal a serious issue, so consult your doctor if you experience them. Side effect 8. Nausea or stomach pain. Nausea or stomach pain can occur with amlodipine, as with many medications. These symptoms are usually mild and rarely lead to vomiting. You can take amlodipine with or without food, but if nausea hits, try taking it with a meal or snack to reduce stomach irritation. If these symptoms persist or worsen, let your doctor know to explore other causes or adjustments. Side effect 9. Low blood pressure. Low blood pressure, or hypotension, is a risk with any blood pressure medication like amlodipine, especially at high doses or when combined with other blood pressure drugs. Symptoms include dizziness, blurred vision, or fainting. Severe signs like confusion, fast heartbeat, or fainting require immediate medical attention. Low blood pressure can be more pronounced if you're dehydrated or taking multiple medications that lower blood pressure. To manage this, stay hydrated, avoid sudden movements, and keep a log of any symptoms like dizziness or fainting. Your doctor may need to adjust your dose or review your medication regimen to prevent complications. Always report severe symptoms like confusion or a rapid heartbeat immediately to ensure your safety. Side effect 10. Muscle tremors. Muscle tremors, though uncommon, were reported in amlodipine's clinical trials. These involuntary shakes or quivering can affect various muscles, sometimes accompanied by stiffness or abnormal movements. These symptoms can be unsettling and may interfere with tasks requiring fine motor control, like writing or typing. If you notice shaky or stiff muscles while taking amlodipine, report them to your doctor immediately. They may need to adjust your dose or investigate other causes to ensure your comfort and safety. Conclusion: there you have it. The 10 amlodipine side effects you need to know about, from dizziness and edema to rare but serious issues like angioedema and muscle tremors. While amlodipine is a lifesaver for millions managing high blood pressure or chest pain, understanding its full side effect profile empowers you to take control of your health. Always monitor your symptoms, stay hydrated, and communicate openly with your doctor about any changes you notice. If you found this video helpful, please give it a like, subscribe for more health insights, and check the description for verified source links. Thank you for watching, and here's to making informed decisions for a healthier you.